Welcome to the Prime Health Podcast with your host, Dr. Derek Barron. Dr. Barron interviews doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. The Prime Health Podcast explores breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So sit back, listen in, and prepare to transform how you think about your path towards Prime Health with Dr. Barron and his special guest.
Welcome back to the Prime Health Podcast. I'm your host, Dr. Derek Barron. I'm here to bring you cutting-edge insights into practical strategies from leading healthcare experts for your journey to Prime Health in life and in business. Now, our guest today, Sherri Mack of Bloom Hemp, has been a nurse for 35 plus years and was at a crossroads when the treatments she was utilizing stopped working, unfortunately. She had to make a pivot in how she cared for herself, which led her to cannabis and eventually CBD, which helped her wean off of the pharmaceuticals that she was on. And that led her into even a deeper mission to help patients find the answers they weren't getting elsewhere. So yes, I'm excited to learn about her path and what she can tell us about Bloom Hemp. Before we jump into the episode with her, just a quick message from our sponsor, Growth Solutions, your growth partner that turns healthcare expertise into market leadership one strategic move at a time. So Growth Solutions eliminates stressors in business such as new patient or client acquisitions, marketing or growth strategies, reducing operational chaos with proven systems, frameworks, and SOPs. And yes, we help you with AI and those AI bots because they're coming after us whether we want it or not. So if you ever thought this, I'm too busy to grow, too slow to scale, or too overwhelmed to fix it, we are your solution. Drop the word grow in below and myself or a staff will get in touch with you, or feel free to reach out to me on any social platform. But you came here for a reason. It's to meet our amazing guests. Sherri, welcome to the Prime Health Podcast, and please tell us a bit about yourself and what you do.
Well, thank you so much, Derek, for having me on. You know, my name is Nurse Sherri Mack. I'm a registered nurse. I'm a cannabis nurse. I'm a cannabis patient, advocate, activist, and a very passionate podcaster here to help change the paradigm of healthcare using plant medicines. I've been a registered nurse for 37 years this year. And I spent a lot of time in the Boston teaching hospitals. I worked at the Brigham and Women's Hospital in Boston, Beth Israel Deaconess Medical Center, Children's Hospital for 25 plus years. And I got sick and found myself on the other side of the bed at one point in time. Yeah.
Well, I'm sorry to hear that. And I'm intrigued here with you and us talking, like you being an experienced podcaster, I've got to up my game. So I'll do the best I can in this process. But I always do ask my guest, Sherri, like, was there a moment in life that said, you know what, I'm going to choose a path or a career in medicine? What was yours?
Well, you know, what made me chose to become a nurse was I had a Rise syndrome as a child, and I was hospitalized in Children's Hospital. And I remember the nurses taking really, really good care of me. And I really loved the comfort that they provided to me and to my family. And so fast forward a couple years after that, I was like 12 and my little brother was 2. He was running down the driveway and I was chasing after him, and he fell and he tumbled and he split his head open, and I immediately scooped him up and started tending to him and taking care of him. And I remember my mother saying to me, "Oh my goodness, you would be such a wonderful nurse." And this was at the age of 12. And so I knew I wanted to become a nurse that early on. And so
That's a great story. They do say moms know best, right? So apparently she had a good plan in place for you. We had shared kind of earlier, I guess you had shared that you wound up on the wrong side of the bed. You were typically the caring individual. You got on the other side. Would you mind sharing a little bit about how that story was that got you there?
Yeah, so I was working in the hospital and I ended up getting a hospital-acquired infection. I wasn't the only one that got it. There were a couple of other people that got it, but I was the one that ended up in the intensive care unit almost dying. So I got a bacterial infection in my gastrointestinal tract that wiped out my gut microbiome. And so the microbiome is its own little universe that helps with immunity, et cetera, et cetera. And mine was completely wiped out. And that ended up leaving me on multiple pharmaceuticals. I also developed an autoimmune condition called polymyalgia rheumatica, which is a chronic myofascial pain syndrome. Yeah. And then as I tell others, I traveled down the road of, the pharmaceuticals, the pills, the procedures, the different specialty appointments. But at the same time, I've also been a holistic nurse. So not only did I do what conventional care told me to do, I also reached out to all of the holistic practitioners that I had become friends with and that I engaged with, and did all of the holistic modalities, and nothing worked. I was getting sicker. And at one point in time, I was on over 18 pharmaceuticals, really sick and suffering. My mental health took a dive. I was a single mother of 3. And it's kind of scary to be in a place knowing you have a lot to live for, but you didn't really feel it. Because I was like, again, I was the pills, the procedures, the medical and pharmaceutical trauma is a real thing. And I would say that I experienced that in that particular time in my life back in 2012.
Yeah. So at that time in 2012, we talked about that little bit of a pivot. So who came into your life that introduced you to, the green medicine?
Green medicine. I know, the green medicine. And trust me, my mother was not happy about that. And she's a big part of my story. So there was a nurse who was a friend of mine, who was one of my clients for energy healing. So I'm a Reiki master. I do reconnective healing work, energy work. And she had been trying to get in touch with me for a long time. She wanted a session, and I was just not in the mood. I wasn't capable of working at all. I was literally disabled at that time. And so she came to my house unannounced and knocked on my door. And I opened up the door, and she had a basket full of goodies. And the goodies was cannabis flowers, a joint, some edibles, some topical, some tinctures. And I said, Marianne, what are you doing bringing me cannabis? How could this possibly help me when the strongest pharmaceuticals and all of the holistic alternative healing modalities weren't working for me? And she basically said, Sherri, you need to get with the program. Cannabis has been around for thousands of years, used as a medicine. She says, as a matter of fact, I've been using cannabis every day since the age of 17. That's 53 years of using a little bit of cannabis. I've never been hospitalized, and I'm not on any ongoing pharmaceuticals. I had to take a look at that. Then she further disclosed that her father was a pharmacist, and prior to 1937, he carried cannabis formulations in his pharmacy. So again, something that wasn't taught in nursing school, isn't taught in medical school, cannabis as a medicine. And so I really, at that point in time in my suffering, had nothing to lose. And so she offered me this basket of goodies. I reluctantly took it, but tried it, and it worked immediately. Pain went from a 10 to a 0. I felt like my head cracked open, consciousness poured in, and I said, wow, if this could really work for me, I need to help others and make it work for them. And I remember going and getting my medical card, and I was plagued with stigma. I was ashamed. I was afraid, because it's seen as, the American Medical Association today still sees it as a drug of abuse. If it's not FDA approved, then, it's not something you should be taking, is the message. So the message that I got from this 70-year-old nurse who's been using cannabis every day since the age of 17 was a completely different message. And I trusted her, and I needed to do something different. I needed to try to use this. So I used the goodies that she bought me, went and got my medical card, and then started on the journey of learning about cannabis and hemp-derived CBD as a medicine.
So you said a word, stigma, and in life in general, there's some sort of a stigma associated with marijuana itself.
Yes.
And now there may be that blend of CBD coming in with that. I don't want to say that there is, but I think people are thinking, well, they're one and the same. I would like it, if you don't mind, Nurse Sherri, to explain to us the difference from cannabis versus CBD.
Okay, so CBD is found in the cannabis plant. Okay. So that's the one thing. CBD can be found in the hemp plant. So when you think of the plant, Cannabis sativa is the real name of the plant. And then there's different versions of it. So hemp is part of the Cannabis sativa plant that has less than 0.3% THC in it. So cannabis products have greater than 0.3% THC and are found in dispensaries, while hemp-derived CBD products have less than 0.3% THC and can be found in retail shops and online shops such as Bloom Hemp CBD.
Okay. So, but you can have kind of a combination of those. There'll be a combined blend of them as well?
Yes. So in order for it to be sold on online, it has to be grown as hemp. It needs to be tested as less than 0.3% THC. But then again, the cannabis market is different because they have to follow the rules and regulations of each state. They have metric, and they have to, seed to sale. Everything is very strategically mapped out for compliance purposes. It's different on the hemp side. So, the high THC products that we see in the dispensary, is what a lot of people are using to get high, right?
Right.
And then as medicine, people are trying to use this as a medicine. Some people are having good results with it, some people aren't. I found in my experience of doing this and learning about cannabis as medicine is that you don't need as much THC as you think you do in order for it to work. And that's one of the questions that we have, is that the big stigma and the big question and the misconception around what I do as a nurse and a clinician is you don't need to be high. You don't need to be altered or impaired in order for this to work as a medicine. And the reason for that is because we have a system in our body called the endocannabinoid system. And that was something that once I learned about how to fine tune it and nuance that, not only using products, but also lifestyle as a medicine, that's when things started to really shift for me.
Okay. So that's going to blend me into the question I want to ask you. So you did start with cannabis.
I did.
You went on to some CBD products. So when did you realize, I guess, in your personal journey, and then as you go into educating people from your store and or from the medical education that you do, what did you do from CBD to be the best place for people to start their cannabis health, wellness, and medical journey?
So basically, when we think about the endocannabinoid system, right? So the endocannabinoid system is the largest neuroregulatory system in our body. It regulates all 11 organ systems, our immune system, and all the neurotransmitter signaling system that give messages to tell your body to either do something or not do something. Cannabis, we have an endocannabinoid system, not because of the cannabis plant, but because we make molecules in our body very similar to the plant. And how and why I realized I didn't need as much THC was because of the endocannabinoid system. The plant makes THC, we make a molecule called anandamide. The molecular structure is the exact same, plugs into the receptors the exact same way. The difference between the THC molecule and the anandamide molecule is strength and potency. We make anandamide upon demand to plug into these receptors. The THC molecule from the plant mimics our own internal endogenous cannabinoid, but fits in a little bit tighter. And so when we are producing our own internal endogenous cannabinoids upon demand to keep our body in balance, we're producing small amounts. So just like cannabis, you don't need a large amount of THC to influence the endocannabinoid system. A small amount is what's needed. CBD, on the other hand, works on over 70 targets, can soften THC, decreasing the psychoactivity, but not taking away the medicinal effect. A lot of patients that come to us will say, gosh, I'm really afraid of taking CBD. I don't want it to ruin the medicinal effect of THC. And I said, well, no, that's a myth. THC gets softened. The psychoactivity gets softened in the presence of CBD. CBD can make it last longer. CBD can also allow your own anandamide molecule that you make internally to circulate in your system longer. So it was really learning about the endocannabinoid system that we have in our body that made me realize that a lot of patients and consumers are over consuming THC as a medicine. They're not getting the therapeutic results that they're looking for. And so how and why we developed our companies and to move forward was based on that. People are making great medicines, people are selling these great medicines, but no one is truly interpreting how to use cannabis or hemp-derived CBD as medicine, and that's what we do as nurses.
Yeah, it's such a great, I love the blend of, we know patients and general population needs it because we were given a system that can benefit from what we can feed it. And then, so you are educating providers as part of one of your companies on how to take a nurse, for instance, because of what you are as a nurse, and I know you help other providers that are out there, but you take a nurse, you say, there's this, emerging, which has been there for a long time, but this emerging market that's looking for you more. Why not help educate them so they're doing it the right way instead of just going down to a dispensary? Nothing against them. They don't always know the best way to treat them or a product, So you're merging that then along with your other company called Bloom Hemp CBD. So I would love for you to explain Bloom Hemp, kind of the CBD, the story behind it, and really what helps you guys stand out from the competition.
Okay, so Bloom Hemp CBD is a company that we vetted years ago. So Elizabeth Mack is my business partner, and her and I actually, when we started Holistic Caring and the Green Nurse together, we started vetting CBD companies, just vetting products, because patients were coming to us looking for trusted sources of how they could get good medicine. So we started Green Nurse Approved. So Green Nurse Approved is literally the stamp of approval from the cannabis nurses that we've actually taken the time to look at these different products. So what that means is, it's quality, there's transparency, there's a website, there's certificates of analysis on every product, there's assistance and help, there's a phone number, there's an address, so in other words, we started vetting products and wanting to make sure and trying them, to see how they work. So Bloom Hemp has been in our product suite since the inception of Holistic Caring and the Green Nurse, since actually Bloom Hemp started. And I think it was back in 2018. And so we ended up working with Bloom Hemp. Elizabeth and I actually helped build a global clinic in Australia in the United States, I'm not going to say the name of it, but we helped build a global clinic, and we used product formulations and formulated products using Bloom Hemp formulas. And so with that, we started, and they ended up running out of money. So we decided at the particular time to buy Bloom Hemp and to really kind of take it to the next level with how we wanted to help not only patients, but medical professionals get access to good quality CBD. So what makes Bloom Hemp a little bit different? Well, Bloom Hemp is doctor and nurse formulated. The original formulator was an Ayurvedic doctor in San Giovanni, New Mexico, Dr. Sunil Pai. He was the original doctor that formulated these formulations. And then when Elizabeth and I bought the company, we had already formulated products for the Australian company, and we took some of those formulations and spin them to symptom targeted formulas for patients to help them get a better day, thinking of eating, sleeping, relaxing, forgetting, protecting your body. And that's what these formulas can do. So not only did we do that, but we also hired a pharmacist to come on staff to help us. We started a free nurse line, and we started doing free emailed care plans. And we also did research. We thought it was really important. It was real world evidence research, so it's not double-blind placebo-controlled studies, but real world evidence, patient reported outcomes can be really, really beneficial. And so we decided to take that under our wing as well and study one of our formulations with women and women's health. And looking at, we studied women between the ages of 30 and 70. We wanted women that were busy, either working part-time or full-time, and that had busy lifestyles, and to try this formulation. And the results were really, really amazing with that formulation. Yeah. So we've kind of, we want to stand out in the space as, a caring, the essence of nursing is human caring, and that's caring for the entire human experience. And so that's what we want. That's what we aim to do at Bloom Hemp, is we have a little something for everyone. We have, again, customized care plans. We have a free network and education that goes along with it. And we do clinical conversations to help educate and empower patients to make choices that are best for them using these different products.
Yeah, I would love it. You say products. So can you help our listeners and viewers? So a lot of people hear about CBD gummies, but there's multiple forms of delivery with CBD and probably your Bloom Health products.
Yes. So we have in our shop, so when you think about, Bloom Hemp CBD has CBD isolate, which is the isolated version of CBD. And so people can do it themselves. They can get the little isolate powders, and we teach people how to make their own. Then we have broad spectrum CBD products. So these comes in capsules, gummies, and tinctures. And I'll go over the different ones in a minute. And broad spectrum CBD is whole plant, 0 THC. So those people that get drug tested, some of our, some of the animal products, sometimes children need to come on these products. We start off with the broad spectrum with no THC in it. And then full spectrum has the trace amount of THC in it. So we have over 30 SKUs, 8 different tinctures, 6 different topicals, 3 different gummies, and the different isolates. We do not sell any smokables or inhalables. I'm not against inhaling cannabis or inhaling hemp, but we have found that can be, you don't really, that can be something that you used as needed, not as a base as for medicine. So a lot of patients that come to us, that work with us, they don't want to be high, they don't want to smoke. And so we are providing those product formulations that, again, doctor and nurse formulated, Ayurvedic inspired, symptom targeted formulas to help people reach better levels of wellness, hope, health, and healing.
Yeah. What are, as a nurse and how you experienced it yourself, what are some of the conditions that, CBD can help with in people if they have it? So if somebody's listening or they're watching, they're like, well, I get migraine headaches and I don't know if this can help or not. Migraine headaches, I've got chronic low back pain. I was told I have fibromyalgia. What are some conditions that CBD has the potential of helping them with?
Well, I'm going to go all the way back to, back in 2018, Paige Fiji, Charlotte's Web, if you've heard of her, the little girl. So, the big CBD craze started again with this little girl who had seizure disorders, and she had over 300 seizures a week. And the first day of using full spectrum CBD, 0 seizures, 0. So it went from 300 seizures a week to none. So huge. Yes. So it can work. When you think about the pleiotropic nature of the plant and you think about CBD works on over 70 targets in the body. So not only is it hitting the CB1 and CB2 receptors of the endocannabinoid system, but it's also working on the larger environment, the endocannabinoid dome. So think about different neurotransmitter signaling systems. So dopamine signaling, serotonin signaling, GABA and glutamate signaling, hormonal signaling, and think about eating, sleeping, relaxing, forgetting, protecting your immune system, right? So CBD can help with people with eating. So people that have issues with one of their formulas is a digestive tincture, and it's got CBD, CBG, botanicals in it. So it's great for patients that have nausea, patients that have issues with gut microbiome issues, patients that have gastroesophageal reflux disease. Another one of our products, the Focus Tincture, has CBD, CBG, and THCV, and that is the one that we recommend for patients that have diabetes or want to lose weight or have issues with glucose metabolism. One of our other formulations called Recovery has CBD, CBG, and some other botanicals such as turmeric and biopepperine, and that can be really great for decreasing systemic inflammation. We have another product called the Immunity Soft Gels, and that's THC free. It has the acidic cannabinoids, CBD, CBDA, CBG, CBGA, and that's a really great long-acting product that can work on multiple different things all at the same time. So it really depends upon what what their condition is, how they're looking to consume, and what their outcomes are. Like, what is your goal for using this? It's different for everyone. So if someone came to me and said, I have migraine headaches, my answer to them would be, okay, well, are you looking to bridge the gap? Are you already taking medication? Do you need something, because migraine headaches, you got to have to think about the other things that are going on in the background, your stress level. How are you managing stress? How are you eating? How are you relaxing? So it's really taking a holistic assessment when we work with patients and not just throwing products at them, right? We provide personalization and customization for each patient that comes to us.
Yeah. Is it true that on your website with Bloom Hemp that people can go there and kind of explain their history?
Yes.
And do you give almost like a care plan for them of options?
We do. So if you go to bloomhemp.com and you click the services tab, we do have an intake form, and that intake form comes to both Elizabeth and myself, and we actually work those care plans within 24 to 48 hours. And what we do is we look at what patients put in, their diagnoses, their age, what medications they're taking, what supplements they're taking, have they used cannabis or CBD before with the results, and what are their goals of using it. And then we provide a customized care plan that's specific to them. And then we send that back to them in an email. And then I always follow up with a phone call, saying, listen, thank you for filling out the intake form. I did your care plan. Please take a peek at it. And if you have any questions, you can call our free nurse line, and we can help you order or answer any questions or invite you into our private network. So we have a way of doing this, and it's just very gentle, very easy, and it's just to help people, feel more comfortable using this.
Yeah. And you deal with the general population for the most part, but I think because of your educational programs that you offer too, you are containing the products that you use, and you're not telling people they can't use any other product or a company
No.
that's out there, but you have the ability to know what's going on from product quality to
Yeah.
product distribution and everything. So you have the Bloom Hemp, and you have your other companies that, as you bring in providers like more nurses that come in, you can educate them and say, in this situation, we would use this product from Bloom Hemp.
Yes. So for example, the Bloom Hemp free care plans are for Bloom Hemp products. Our
Okay.
other company, Holistic Caring and the Green Nurse, if patients are booking consultations and coaching with us, oftentimes we'll ask them, sometimes they're already using products. What are you already using? What do you have? And if they're not using anything at all, then we'll bring up Bloom. But if they already have a provider that they're working with, we try to make the products that they're working with work for them.
Okay. All right. And Sherri, you said that you have a nurse line. So that means one of the nurses that's gone through your training program, they get on the phone and they talk to them about it.
Yes. So we have a free nurse line, and the nurse line is a triage line. So when you think about triage, patients are calling, they're asking questions, and and so what we do is we figure out what they need to do next. You would probably be more suited to get a full assessment and a full care plan and a full consultation and working with one of the nurses, or it would be, you might be fine just filling out the intake form and just get, so we generally triage patients and problem solve. And that's what nurses do. We're problem solvers. We think on our feet. We have the ability to, help direct and guide and educate and inform, and to help them make decisions that are best for them. So it's just kind of like a steering mechanism. That's what the nurse line does. Oftentimes patients will call up. I had a patient that called up recently, and she was switching from some dispensary products over to our products. And basically she was finding that she was struggling with it. And so basically what that calls for is more of a nuanced approach, because she's on multiple pharmaceuticals. At the same time, she's trying to come off of pharmaceuticals and she's using supplements. And so it's not as simple as saying, stop this, do this. Yeah. It's more along the lines of looking at everything. So looking at biopsychosocial, spiritual, everything that we do or don't do in our lives affects the endocannabinoid system and how these products are going to work in your body.
Yeah, I love how you say the endocannabinoid system. Like, it's a learning experience for me to learn about the system and what it can do. And I love how, whether it's the nurse line or whether it's the other businesses, people aren't sure who to trust or what to trust because they go by the stigma that's out there. So how do you think that your company, especially Bloom Hemp, helps people get past, the stigma, or really build trust that your company is the company they should choose?
Well, I think how we move through stigma is that both Elizabeth and I are very transparent about our health and about how we use these different products to manage our lives. So the therapeutic use of cannabis has been defined, or even hemp CBD has been defined as the use of cannabis and CBD for medicinal, wellness, and healing purposes. It's personal and subjective to each consumer, with objective criteria being improvement in one of the 5 health domains without negatively impacting any of the others. So I think that us being radically honest and authentic and transparent in our lives is helping people feel more comfortable in using this in their lives, and maybe being open to trying it. And that would lead to my story about my mother.
Yeah. Well, don't forget about that. And maybe this would lead into, when you say the 5 health domains, would you mind explaining the 5 health domains?
So the 5 health domains: the biological health domain, that's your physical, your mental, emotional, spiritual, and social. So these are 5 health domains, the biopsychosocial, spiritual aspects of healing. So in other words, if you're using cannabis or hemp or any of products, and you are, having a benefit in your social life, right? Or, your social anxiety is being managed. You're everything's great. But at the same time, you're not eating well, you're not sleeping good. So other aspects of your health, you're not connecting with your family, but your social life is great. That may not be therapeutic use. So therapeutic use of cannabis is very definitive. You're either using it therapeutically or you're not. And it gives people a way to judge their behavior or assess their behavior and how they're consuming it very intentionally. So if you're just grabbing the vape pen, and just inhaling, or just grabbing gummies, that's not therapeutic use. It's like, it needs to be intentional, but people want to just have fun. Then that's different. If they want to have fun and get elevated, then that's different. But using it as a medicine is very nuanced and very different. And it requires a thoughtful, intentional approach. And that's what we do when we're working with patients. We help them to see a little bit, go down the rabbit hole a little bit and pay attention to their smart body. And we do. We all have very, very intelligent, smart bodies that are capable of healing. But you have to pay attention to everything that you're doing and not doing. And that includes, again, what are you eating? How are you sleeping? What are you putting into your mind? Who are you hanging around with? Just as simple as that, right? Are you in a good work environment? Do you have healthy relationships? All of these different things can influence the aspect of how cannabinoids work in the body.
Yeah. And I can see how it's so much more valuable with Bloom Hemp because of your nurse line, because of your care plans. And I don't know much about going to dispensaries, but you're going to walk in there and say, I've got migraine headaches. Okay, you can take this one. You're telling them that your potential clients need to understand that there's so many variations within those 5 health domains that maybe a blend of these 2 or these 3 or just this one, try it for 30 days versus, hey, this is one of our products. It's on sale. Why don't you buy it? Big difference in the country versus what you're doing. Yeah,
absolutely.
Yeah. Well, I'd love for you to share the story about your mom and how she's the one that said you should be a nurse when you were 12. But then when you made the decision to alter that a little bit, I'd love to hear that.
So when my mother first discovered that I was using cannabis as medicine and then decided that I really wanted to pursue cannabis nursing as a career, she was not happy. Very Irish Catholic, strict. And she blocked me on Facebook and wrote me out of her will for about 2 years. I kept getting letters, but I kept getting better. And so the impetus for me starting my podcast was in 2018 when the National Council State Boards of Nursing came out with a call to action that all nurses, nurse practitioners, and nursing students must have 6 essential areas of knowledge when it comes to cannabis as medicine. That to me was a light bulb that I needed to start educating and to become authentic and real, transparent, and share my story and then the healing stories of others. So I started my podcast, and one of the consumers that I had on my podcast was actually a patient who really wanted people to know that this was not the devil's lettuce. She was a nun. So Sister Suzanne was a nun who was misdiagnosed with MS, was on multiple sclerosis, was on multiple pharmaceuticals, fell, ended up in the hospital with chronic regional pain syndrome. And chronic regional pain syndrome is one of the worst pain conditions that people can have. She was on 400 micrograms of fentanyl. She was getting lidocaine infusions. She had an internal neurotransmitter stimulator implanted in her back. And she was still only functioning 2 to 3 hours a day, with the remainder of her time being in bed. So I worked with Sister Suzanne over the course of, and I'm still working with her, and she's doing great, over the course of 6 months, and helped her to get comfortable using various cannabis products from the dispensary, as well as Bloom Hemp CBD products together in conjunction. And then she was able to wean off of her fentanyl. Once she got off of her fentanyl, completely gone, opioid free, Sister Suzanne was like, hallelujah, this is not the devil's lettuce. This is the Lord's kale. And she wanted to share the message with people. So I made sure that it was okay, and it ended up being okay. We had disclaimers and disclosures, et cetera. She wanted people to know the story. So she came on my podcast and she shared her story of what it was like going through the medical and pharmaceutical trauma, and then what it was like introducing cannabis into her life and weaning off of fentanyl. And the interesting thing, at the end of the podcast, I said to Sister Suzanne, I said, my mother is not a fan. I said, I love my mother very deeply. And I said, what would, for people that are scared about the religious aspects of using cannabis as a medicine, what would Jesus say? This is with all due respect. What would Jesus say about all this cannabis? Wow. And Sister Suzanne held up her finger and she said, Sherri, Jesus would say, what the frig did it take you so long to use this God-given plant that I created for you? It would be a sin not to use it. So Sister Suzanne's message rang loud and clear. I took that little clip. I sent it to my mother. She ended up watching the show, and she finally called me up and she said, really? You helped a nun come off of fentanyl? And I said, yeah, I did. And she says, okay, I'm ready. And so basically, my mother was the most challenging patient I've ever worked with, but we ended up getting my mother comfortable. But it also helped me to work with patients that are plagued with stigma and really helped to soften. And this wasn't about my pace and what she needed, but what she felt comfortable with. So with my mother, we just started off with a topical. And when you put a topical on your skin, it doesn't get into your bloodstream. She needed to just feel comfortable putting a CBD topical with a little bit of THC in it on her skin and knowing that she's not going to be impaired or high. So that's where we started. And then after a month of that, she says, okay, it could be better, couldn't it? Yes, it could, Mom. So we're going to continue with the topical. Now let's put a little something inside. So we did broad spectrum CBD. So broad spectrum CBD is whole plant, 0 THC. She was very afraid of being altered, of being impaired, of losing control. But it started to help, and she started to notice a difference. And she was like, wow, this is really working. I'm not needing as much of my other medications. And so again, she came to me and said, this could be better, couldn't it? And I said, yes, it could. Why don't we fold in a little bit of THC and use the full spectrum? So full spectrum is whole plant CBD with the trace amount of THC, the legal amount. She started using it and she absolutely found relief. And then later on, about 6 months down the road, she was doing well and she was like, okay, I want to be brave. I want to try the THC chocolate. And she goes, I want to know what it feels like now. So this is my mother who blocked me off Facebook, wrote me out of her will. I want to know what the THC really feels like. So we got her a chocolate bar, and basically the instructions were you're to take 1 square. That is it, 1. And if you get into trouble, call me. If you start to feel too elevated, you can take some of the CBD because it'll soften the THC and you won't get anxious. She never called me at all. So I waited and waited, and I called her the next afternoon and I said, hey, Mom, how's it going? She goes, well, I didn't listen. And I go, of course you didn't. What happened? And she says, I ate 3 chocolate squares. She goes, I'll never do that again. But she said, I know what it feels like. And I said, well, was it horrible? And she says, things were very different. I laughed a lot. I was, I had fun. Things that weren't funny were funny. And but she basically said, now I know what my dose is 1 square. I'm not going to do the 3 squares again. And then my mom actually became a proponent of cannabis as medicine. She started going to her doctors and saying, my daughter is a cannabis nurse. And she came on my podcast. So it's a really wonderful show. When she came on my podcast, one of the compelling things that she said that I love to share is she goes, I feel good and I'm not high. I go, Mom, that's important. What does it mean to feel good and not be high? And she says, well, the pains become background noise. I'm sleeping a little bit better. I giggle a little bit more. I'm not so grumpy about my medical problems, and I'm not so depressed anymore. But are you high? She goes, well, if I eat 3 chocolate squares, I will be. But with 1, I'm not. I feel good. Yeah. And so that to me was very compelling, compelling. And so she's now a proponent of using it and is doing the best she can. She's going to be 83 this year. And she still is a fan. And I'm back in the well.
That's good. That's a wonderful story to hear. And I'm glad you were able to experience that with your mom. I'm sorry you went into it, but I'm very happy that, she's come out on top of that. And I love how she feels good without being high. That's a very neat approach to it.
And that's what patients need to understand is you don't need to be high. I've used a couple of cannabis formulations today, Bloom Hemp CBD products in particular. I haven't inhaled cannabis in a couple of years because I want to stay young, and for me, it's all about vanity. So, I don't want to smoke. I don't want to inhale. So for the most part, I use CBD products, full spectrum with a trace THC, but I'm not impaired at all. I'm functioning. You can see that I'm articulating, and I'm not high. I feel good.
No, you're fantastic. I'll tell you look fantastic, and I love having you as a guest.
Well, one other thing I did want to share too was that word high, and I share it on my podcast. That hope and we're trying to change the stigma around that word. I'm not high, but I feel good. So I like people to think of the word high as the H is for hope, I is for inspiration, G is for growth, and H is for healing. Cannabis and hemp-derived CBD products, Bloom Hemp products, bring hope. Hope
Yeah.
that I can have a better day. Hope that I can have a good night's sleep. Hope that I can eat that meal. Hope that I can get on the floor with my kids and play, right? And once you have hope, what happens? You become inspired. And when you're inspired, you're in spirit and you're open to receiving information that you may not be open to receiving before. So with hope and inspiration comes growth. Growth is an action word. You have to do things to grow. You can't just be stagnant. And so the growth is doing different things to support and nourish the endocannabinoid system. And then healing. Healing isn't the absence of illness or disease, right? It's doing the best you can with what you have right here, right now. And healing is on a spectrum. So so when we're working with patients, again, we ask, what are your healing goals? And everyone's goals are different. They're all different. We have cancer patients coming to us. Some of them, don't want to, of course they all want their cancer to go away, but their goal at that particular time is to mitigate side effects. We focus on what patients want and need. And we help educate them to bring that to fruition using these various plant formulations.
Okay. You dealt with a nurse, you dealt with your mom, you dealt with yourself, many other patients that are out there. How do you handle or how do you discuss expectations of somebody that's never used a product, maybe never inhaled THC, CBD, anything like that? How do you, if they, regardless, and it's such a broad box.
Yeah, no, I know. So
when the expectations of getting better.
The expectations of getting better is that it's not a one size fits all approach. Sometimes it requires various formulations, stacking of multiple products. Sometimes we fold in nutraceuticals and we also look at lifestyle. So it's really, really important for patients to understand that everything that you're doing or not doing in your life in regards to particularly eating, diet is huge. Fast food, fried food, fake food, artificial flavors, artificial coloring, trans fat, hydrogenated oils, high fructose corn syrup, sugar, alcohol, all have a negative impact on the endocannabinoid system. So the more you can clean up your diet, guess what? The better the products are going to work, right? Motion is the lotion. Like that's another one. Exercise and movement. When we don't move, what happens? Joints, ligaments, muscles, everything sticks together and gets sticky, right? So think of motion as the lotion. And when we exercise, we get that feel-good feeling, that anandamide molecule starts to circulate, that bliss, right? Because if we didn't feel good when we exercised, we wouldn't exercise, right?
Okay, right, that's true.
So an exercise can help stimulate and upregulate the endocannabinoid system. So we encourage gentle motion and exercise. That can help as well. So we always tell patients that these products work. It depends upon how your lifestyle is to begin with and what needs fine tuning. And oftentimes these products lead people to fine tuning because they're seeing an impact. They're feeling better. And they can be expensive, right? So why wouldn't you want to do something naturally that you can do on your own that costs nothing, right? To influence this most important system in your body and get the best bang for your buck using these products.
Yeah, you're priming yourself for it to work better for you, really,
Exactly.
to work better. So there's tremendous amount of detail into how this can help people. Are there some situations which it's not good for that you would say, if we don't suggest you taking a CBD product if you do have this issue?
I can't think of really anything. I mean, for patients, CBD is a great antipsychotic, which is great. But cannabis, high THC is not good for psychoses and bipolar disorder, right? So and then you have to look at the biphasic nature of the plant and the different components of the plant. Low doses do one thing, high doses do something else. I'm also a pediatric nurse, so I take care of a lot of families and children as well that are introducing this into their lives. So it's really, CBD in particular is very, very safe. The other issue with CBD would be if someone's on a lot of pharmaceuticals too, because CBD can potentiate a lot of pharmaceuticals and make them work stronger and better. So in particular, but I wouldn't say that there's anyone that I would admit from the list of using
Okay.
CBD. No.
Yeah. And I mean, it's known that it helps people with cancer and dementia,
Yes.
where some would say, I don't want to do that. They don't want to take medications for it, but this is a great option for them to
A
look
great
into.
option. Great
Yeah.
option.
Yeah.
Absolutely.
That's fantastic. I mean, I just, I'm learning so much about this. It's amazing. I want to ask a question. You had said CBD and CBG. Do you mind? Yeah, I don't quite understand the mix of the two.
Okay, so the plant has, over 140 phytocannabinoids. So cannabinoids are molecules that interact with the endocannabinoid system. So phytocannabinoids are cannabinoids that are found in the cannabis and hemp plant. And there's
Okay.
a lot of them. THC and CBD are the two primary. Some of the
Okay.
minor cannabinoids, CBG in particular, I love. It's one of my favorites.
Okay.
CBG is one of the mother cannabinoids. So CBD, and so when the plant is going through its curing process, it converts into different levels of cannabinoids. So when the plant's raw, you have raw acidic plant, and when it's hanging and it's curing and it's maturing, it can develop into other things. So CBG is one of the minor cannabinoids that has been researched and studied and substantiated. CBG helps us to produce our own anandamide molecule, the bliss-like molecule that mimics THC.
Okay.
CBG is really great for anxiety, really great for gut-brain access, really good for a lot of different things. And people sometimes don't need as much THC when they're using CBG because it
Okay.
does stimulate your own anandamide molecule. And so our formulations do have, various amounts of CBG in them. It's not just, we do have a couple of products that are just CBD only, but a lot
Okay.
of our formulations at Bloom Hemp have combined cannabinoids in them because that promotes the entourage effect. And the entourage effect states that the whole of the plant is greater than its individual parts. So you have to think about it. It's working on multiple receptors, multiple targets, multiple symptoms, all at the same time. And the word pleiotropy is the word that I would like to use. The pleiotropic nature of the plant is where it's working on multiple physiologies all at the same time. So having multiple cannabinoids in a formulation, and that's where the whole plant full spectrum comes in.
Okay. So you had also said, Sherri, that you're a pediatric nurse. So, and I know you kind of gave us a story of the young girl that took it, but does that mean you work with parents and kids when it
Yeah.
comes to, utilizing CBD?
Yep, I do. I've taken care of quite a few families, some of the families that have autism, epilepsy, cancer. I've also taken care of some families that have wanted their children to stop vaping, a harm reduction approach. So, and there was another family that I took care of back in Massachusetts, helped a kid get off of heroin using cannabis.
Nice.
Yeah.
Yeah.
Mhm. And it was a family affair. So we ended up teaching the family how to grow their own and make their own medicine. And so
Okay.
family got involved, and it was really beautiful. And this kid is now, opioid free,
Yeah.
just using.
That's a blessing. Yeah. Thank you for doing that for that family specifically. I mean, that's wonderful. With your website, bloomhemp.com, can people purchase from all 50 states?
Yes, all 50 states. Bloom Hemp can be shipped to all 50 states. Again, it's from the farm, and the distribution, the manufacturing is all in Colorado.
Okay.
And we have a great team out there that helps us with everything. But we provide all the customer service and all the education and all of the coaching and consulting for people that shop at Bloom Hemp CBD.
Okay. There's been a great episode. I love this. Again, it's a super huge learning curve for me, so I appreciate this. But I would love to know, what's the vision of Bloom Hemp over the next maybe 3 to 5 years?
So I'm hoping in the next 3 to 5 years that Bloom Hemp CBD is one of the companies that Medicare will be covering. It would be lovely. That would be my dream and my wish, is that, since we're doing the right thing for the right reasons, we are nurses, we are educated, our formulas stand out. There's, certified organic hemp CBD, all of the certificates of analysis for all of the products, all of the education, and, doctor and nurse formulated. We're hoping that we are more doctors' offices and nurses will be carrying our formulations and recommending Bloom Hemp CBD. We hope Bloom Hemp becomes a household name at some point in time, and that it would be covered by insurance. That would be my goal.
Yeah, I'm sure there are many people that want that goal to be achieved as well. So that's wonderful. So I've got just a few more questions for you, but if there's somebody that's interested, whether it's for themselves, a family member, somebody else like that, that wants to learn more, I think we gave the website, but where do you want people to go to learn more about Bloom Hemp?
Yeah, it would actually be bloomhemp.com. We also have a blog on our website, which is great. And we also have Ask the Green Nurse on the Bloom Hemp website. So a lot of times, Ask the Green Nurse, I started that last year, actually syndication. We got syndicated with the Canigma, and I have a beautiful Substack where I'm writing, where anyone can ask a question at any point in time. And I might actually write about it in my blog, but anyone that has a question, they can email info@bloomhemp.com. I will reply back with the answer to their question, and their question might actually become a blog that I share publicly.
Yeah, that's interesting. So 2 last questions here. Being a nurse, you've lived a healthy lifestyle after finding out you needed to kind of change the approach and what you went through. But if you could give us one piece of advice that would help us all in a positive way, what would that be?
The big thing that I would love people to think about is that we have very smart, intelligent bodies, and to just be really intentional about how you take care of them and what you do. You only have this body for a short period of time in this lifetime, and you can't get another one. So it's really about, thinking about, what are you eating? How are you resting? How are you taking care of yourself? Who are you surrounded by? So really just paying attention and having strong boundaries on your own healthcare. So take your health into your own hands and, go to the doctor, but also do your own research. A lot of times, we have a lot of the older folks that we take care of have poor health literacy, and they're literally just listening to what the doctors say and doing what they say and not looking into anything else. So it's just really question everything and and live your best life.
Yeah, I love that. Last question as we close up here. You've been a wonderful guest on the Prime Health podcast. What would your definition of Prime Health be?
My definition of Prime Health is literally being in a flow state, right? And my word of the year is coherence. So coherence is different than balance. So coherence is when nothing is at war with yourself, right? That's what it would be. So when you are at peace with mind, body, spirit, soul, everything. So that would be my definition of Prime Health is, living my best life in coherence, in a flow state, and feeling good.
And sometimes using some Bloom Hemp CBD, right?
Right. Sometimes using some Bloom Hemp CBD. Absolutely.
I love it. Sherri, thank you for that. You've been a wonderful guest. I really love your storyline of how you got into this. And I'm sure whether you had stigma on it or not, but you went from a lot of people that make change, like you're an entrepreneur. Entrepreneurs make big changes in the world. That's because something happened to them. Unfortunately, you got sick in a position that you loved. You love being a nurse, but that changed things for you. And there are many people that need to listen. I'm sure listen to your podcasts that are out there that learn that it's okay. The stigma is there. We'll help you get away from that. We'll help you. We'll educate you on why you should do that, because it sure seems like there's more and more people that should be utilizing some of the Bloom Hemp products. And specifically, it's so interesting how the nun shared that, Jesus would want you to have this. I love that. How your mother came around and, it's helped her, but it's built your relationship. I think that's fantastic. And I always tell people that watch or listen to the show, you've heard Sherri say something, and I'm just asking you one thing. Would that affect a friend, a family member, or a healthcare professional that please share this with them. They're doing the best they can to help the world on a U.S. standpoint, but also global. So please do share this. From my perspective, I'm always selfish and say, please do subscribe or share our podcast. That's great. We would love you to do that. But as we wrap it up, until next time, remember that true wellness is a journey we are all on together. So whether you're taking charge of your own health or guiding others in theirs, every step forward matters. Please do stay committed to your Prime Health journey. And again, Sherri, thank you very much for being an exceptional guest on the Prime Health podcast.
Thank you.